Hey everyone, welcome back to New Method Live. I am so excited that you're here. And today we are going to talk about heartburn. Let's jump in. So, heartburn, reflux, GERD, millions and millions of people have it. And if you're listening, you're probably one of those millions. So common that most people just accept it as normal. Or maybe it's just part of the price of eating whatever it is that you just ate that caused you heartburn. Most people just ignore it, or maybe you're one of those people who pop a pill to calm it down. But reflux is really your body's way of screaming at you that something is wrong. And we have to talk about that. It turns out that having reflux over time can cause some pretty serious issues. But the crazy thing is that the medications that we're given for reflux can also cause some pretty serious issues. So even though it's making you feel better, it's actually harming you. Today, we're going to talk about what reflux is, what causes it, how to treat it, and why you should stay away from those meds if possible. If you're listening to me on the podcast, maybe washing the dishes, maybe putting up your Christmas lights, you're not, as always, I'm wearing my red stethoscope that my wife gave me. Thank you, Gina. And my hair is amazing. And other than that, you're not missing anything. So I'm glad you're here. And if you don't know who I am, my name is Efrat Lamandre. Everyone calls me E or Dr. E. And I invented the new method where we empower people to realize that their symptoms are not in their head. So reflux is an uncomfortable, burning feeling in your chest that can move up to your neck and your throat. You might even have a bitter or a sour taste in the back of your throat. And heartburn can last a few minutes or several hours. And it usually feels worse after you eat or when you lay down too quickly after eating. Some people experience it once in a while, and some people experience it so frequently that it's then called GERD, which is chronic reflux disease. And if you leave it untreated, here's a big deal. If you leave it untreated, not only is it uncomfortable, but it can cause an ulcer, bleeding, and esophageal cancer. So it should never be ignored. Okay. I love that you listen to my episodes, but always go to your GI, figure out what's going on first. Never self-diagnose, never self-medicate. I say it every time, but I cannot stress it enough. So what is it? What is GERD? I get it. I feel this thing, but what is actually happening in my body? Okay. So when you eat something, food goes down a long tube that connects your mouth and your stomach. And that tube is called the esophagus. And at the bottom of the esophagus is a small valve. It's a sphincter. So it looks like this. And its job is to open to let food in and then close to make sure the stomach contents don't go up. Okay. Because in your stomach, there's a lot of acid that helps break down your food. And your stomach can handle that acid. It has special lining that it can handle that acid and you don't feel it at all. The problem is if any of the stomach acid gets into the esophagus, that's painful and that's reflux. So reflux, just to say it again, is when the stomach acid goes into your esophagus and causes pain. So it's not about like the stomach acid. It's about the fact that that sphincter isn't closing properly, allowing the acid to come up. And I'm going to explain that more. It's a really important concept to explain that it's about the acid being in the wrong place. But what happens? People feel the acid and they say, oh my God, they either go to their GI or they go to the local pharmacy and they say, this really burns. It feels like burning. I feel burning here. I feel burning everywhere. And logically, you can assume, you would think that this is a conversation of too much acid in your belly. So there's too much acid in my belly. I need something that's going to calm down the acid in my belly. And so you look for meds. And there's 3 kinds of medications out there. Quick recap on them. One is an antacid, like Tums. If you already have acid, you take the Tums and it neutralizes the acid. Another one is called an H2 blocker, which is like Zantac, Tagamet, Pepcid, and they decrease the production of acid. And then another one is called a PPI, proton pump inhibitor, which is your Prilosec, omeprazole, Prevacid, Nexium, and they stop the acid from being secreted into the stomach. Okay, so you eat whatever you ate, your pizza or your spicy food, and then you have pain, and then you take the medication, and the pain goes away. So what's the problem? Everything is fine. What's the big deal? I'll eat something that gives me reflux. I take medicine. Everything's fine. Of course, it's not fine, or else I wouldn't do a whole episode on it. But, I figured let's talk about it. So the first problem is we have to find out why you're having reflux in the first place. Because reflux doesn't mean there's something wrong with your body. It means your body is calling your attention to something. The symptoms are a warning sign. They're not supposed to be suppressed. It's supposed to be heard and addressed. So by taking the medicine, all you're doing is suppressing the message, but you're not actually getting the message. The second issue is that reflux is actually not a problem of too much acid. It's actually a problem of too little acid, which we'll talk about in a little bit. And the third problem is that when you use these medications, the medications to suppress the acid, it actually causes us harm. When they first came out, when the PPIs first came out, they were out with like a warning. Hey, make sure patients stay on this for 6 weeks or less. But over time, that warning is gone. And now we have patients on it for years at a time. So let's go through all those problems. What causes reflux? Remember, we said the problem behind reflux is not that you're making too much acid. It's that the acid is in the wrong place. It's when that sphincter doesn't keep things closed. So we have to focus and figure out what is causing the sphincter not to close, the tone of the sphincter. What's causing it not to close properly? And it's really important to understand that if we understand why the sphincter isn't closing properly, then we can get to the root cause of reflux, which has nothing to do with overproduction of acid. Remember, it's just that the acid's in the wrong place. It's in the esophagus instead of the stomach. So the question is not what is causing acid. The question is what is causing the sphincter to malfunction. GERD is a reflux is caused by too much pressure in the stomach pushing up on the sphincter. So sometimes it could be simple mechanics. And of course, I forgot to click on my things, but here we are. I'm clicking. Okay, sorry. So we said GERD is too much pressure. So what causes pressure? The first could be just simple mechanics. If you eat a lot before bedtime and then you lay down, your stomach is just going to push up on that sphincter. The sphincter is going to open. You're going to feel reflux. If you're already full and you keep eating, same thing. It's big. It starts to push up on the sphincter. You're going to have reflux. People who are overweight have reflux more often because the girth of their belly, the fact that their belly is big, is automatically pushing up. And then, of course, pregnancy does the same thing. It pushes up. So we have a mechanical issue pushing things up. The second is your body's reaction to stress. So when we're stressed, your body is pretty cool. It thinks that you're being chased by a lion. If you're being chased by a lion, your body no longer cares about digesting your food. It's worried about getting you the heck out of there, right? And now, if you're stressed because you have a deadline, a final, a report to hand in, it still thinks you're being chased by a lion. So it slows down digestion in your belly. It doesn't break down the food, which means the food is sitting in the belly longer, which creates more pressure upward, opening up the sphincter. So stress is going to cause heartburn because of this pressure. And studies have shown that when you're under stress, that very, very tender esophageal lining that we talked about is even more sensitive. So stress, eating while you're stressed out, can cause reflux. Nutritional issues, of course. If you have a food sensitivity like gluten and dairy, remember, it's going to make you feel bloated. Bloated is air. Air is going to push up on the sphincter. If you're eating lots of sugars and starches, it can cause fermentation and malabsorption. Again, creating gas in the belly, creating a backup, and creating that problem. Some medications that you might be taking, because their job is to relax things, they might actually be relaxing your sphincter also. That's especially true for some blood pressure medication. If you're on a calcium channel blocker, that's known to affect your sphincter. So great, your blood pressure is down, but now you might be more prone to reflux and GERD. And certain bacteria, specifically H. pylori. If you've ever heard of H. pylori, if you have GERD, if you have reflux, you should be tested for this. H. pylori is the most common chronic bacteria in humans. Statistics show that more than 50% of the world population has this bacteria. And infection rises 1% with every year of life. So if you're 70 years old, you have a 70% chance that you have H. pylori. And you continue from there. H. pylori's connection to GERD is a little complex, and we're going to explain it in a minute. But the important thing is that not only is it in your stomach, but it could also travel up to your esophagus, which can also make it more sensitive to acid. So if you have GERD, reflux, heartburn, make sure you get tested for it. Now, notice my list, which I have here: pressure, stress, food sensitivity, medications, bacteria. At no point did I say that heartburn is caused by too much acid. In fact, people who have heartburn, reflux, GERD have too little acid. Let's talk about that, especially regarding those last two things. When we're talking about malabsorption of food or bacteria, it's about not having enough acid. As we age, we produce less stomach acid. The younger you are, the more stomach acid you have. So if stomach acid was the issue, then we should see reflux and heartburn in our 20-year-olds and our 30-year-olds. But instead, we see it more as we age because it's not a conversation of how much acid you have. So one of the chief roles of the stomach acid is to prevent bacterial overgrowth. If the stomach is usually a pH of 3 or less, and most bacteria cannot survive. But when stomach acid is less as we age, we produce less stomach acid, the pH goes up, and now bacteria starts to thrive, which is why we have more H. pylori as we age, and which is why we start having more reflux as we age. The other thing stomach acid is supposed to do is supposed to help us digest and absorb carbs and foods, because it tells the pancreas, hey, release some enzymes, and they start digesting. But again, we're producing less as we're older, so the stomach pH goes up high, and we don't have enough pancreatic enzymes, and the food is not broken down. So either the food is not being broken down, or we have these extra bacteria. Both of these things cause bloating and gas. Now we have increased pressure in the abdomen, and voila, the sphincter gets open. So reflux, although it feels like it's an acid problem, it's actually an issue of not enough acid. So we have this whole mess happening because we have less acid in our belly. And what do? We run for an antacid, or something that stops acid altogether, which in fact makes the problem worse because we didn't have enough acid to begin with. Now we took a medication that makes us feel better because it stops the acid from going in the esophagus, but now we have even less acid. So if we have bacteria, more of it is going to grow. If we have bloating, we're going to have more bloating. So we're actually worsening the problem, taking the medication that we thought is helping. And what's worse is that shutting off the acid causes problems. These medications cause problems. Suppressing stomach acid means we're not digesting our food, which means we're not digesting our vitamins, our minerals. We're not absorbing B12. We're not able to digest protein. And these drugs are so powerful. They're basically shutting down the digestive functions that we so need at any age, but of course, as we age. And they also cause irritable bowel, bloating. There's studies that show it causes pneumonia because it causes so much bacteria to grow, osteoporosis, fractures of the bone, pathological fractures, and chronic kidney disease. So what they do is harmful in the sense that they shut off the acid, and they have a side effect of all these other things. They were never meant to be taken long-term. They were designed to be used short-term to protect the esophagus as you address the actual issue, and then never need them again. But of course, we take the med. Many of us don't address the actual issue, and so now we're stuck on this medication and stuck with all the side effects. The key is not taking the drug. The key is finding the root cause, reducing the pressure on the sphincter, making sure you don't eat 2-3 hours before bed. Digest your food. Don't eat when you're stressed. Your body needs to be relaxed when you're eating so that it actually can digest. Don't overeat. Remove the trigger foods, alcohol, caffeine, nicotine. All of those open up the sphincter. Go low carb if possible. If none of that helped, do some food sensitivities, especially gluten and dairy. If you don't want to do food sensitivities, Just try life without gluten and dairy. What's the worst that can happen? You'll feel amazing. That's pretty much the worst that can happen. And of course, test for bacteria. If you're already on this drug, what do? If you want to come off of it, don't just stop. Please don't just stop. You're actually going to, not be in a great place. Make sure you address the issue. Make sure you do all the things on the list. But if you stop the drug, what happens to many people is they'll have a rebound acid production. The body's going to be like, oh my goodness, and just now produce too much. So when you stop, you want to stop, taper it down. So if you're at 80, you go to 40, etc. Taper it down, don't just stop. There are also amazing supplements that you can use. Instead of using Tums or Rolaids, have its own side effects. There is a licorice called deglyceride licorice. The small little tabs, you can chew them before you eat, before bedtime. Helps heal the belly. Glutamine is an important amino acid that helps with gut lining. It helps heal it, helps soothe it. Digestive enzymes to help you break down the food, because remember we said it can ferment and cause bloating. Magnesium relaxes the digestive system, and zinc is really important for activating your enzymes. So let's recap. Reflux, GERD, heartburn, even though it feels like acid, it is not from too much acid. It's from acid being in the wrong place, hitting your esophagus, from too much pressure in the sphincter. Watch your trigger food. Avoid foods that cause bloat or cause distress. Don't eat before bedtime. Get tested for food sensitivities. Actually fix the issue and do everything you can to avoid needing medication. If you do need the medication, use them short term as you fix the issue. And if you're already on them, consider tapering off. And as always, this is a lot of information. If you want to work with me and my team, you can find us at The New Method on every platform. Private message us, go on our website. We're here for it. Wherever you are, we will find your message. We look forward to hearing from you because you always knew there was a better way. I will see you guys next week.